Thank you for joining this live TikTok today. This is Jacaranda Maternity Hospital. We normally have dermatological condition clinics at all our 3 branches. Today, we are going to talk about understanding acne with me, Kagendo Charity, who is the clinical dermatologist holding clinics at Jacaranda Maternity Hospital. So first let's start by understanding about acne, how it develops and how to go about it. So in the current world of today, statistics say that in people aged between 11 and 30 years old, about 80% of them they usually have an issue with acne. So it's a very crucial topic for us to understand, so that you may be able to know how to manage it, because it's possible for you to manage it while at home also. So putting that in mind, acne usually affects mental awareness of a person and also self-esteem, and at times you need extra help for you to tackle acne. How does acne usually develop? So acne usually develops when the pores, considering that the body is usually, we have pores in all over the body, but there are areas which have more oil glands more than the other parts of the body. So in these parts of the body, you find that due to a cause, the pores become blocked, causing inflammation due to accumulation of some substances, causing swelling and pain, whereby you will find some people, they have different presentation of acne. Maybe one may have pustules, nodules, blackheads, and whiteheads. So it can be very painful, very itchy, and they usually also affect the appearance of a person. So it's good for us to discuss about that one today. The medical term that us medics usually use is acne vulgaris, but it is also good to know that acne, there are various different types of it. We have fungal acne, we also have hormonal acne, cystic acne, and also there are times we do grade them. We have 4 gradings that we can grade depending on the type of acne that you're currently experiencing. So most of the people, they usually tend to tell someone that they started developing acne when they started their menses. So one can get acne as early as from 11 years due to the hormonal changes, the introduction of the androgen hormones at the puberty level. But at the same time, there are people who develop acne when they are adults. Those who develop at puberty, the acne can progress up to adulting, but there are those who also develop acne while they are adults due to some factors that we are going to discuss, which are the causes of acne. What can make me develop acne? Acne, or rather the way we mostly call them pimples, they normally do occur due to factors that affect them, such as diet. Taking a lot of sugar, wheat, and carbonated drinks usually predisposes someone to have acne. That's why most of the time when you come for acne treatment, I usually insist, like, you have to reduce, if not stop, you have to reduce on taking carbonated drinks because of the high sugar levels, wheat, and also oily foods. Even oily foods, though not all, but it's good to avoid eating a lot of greasy foods. The other factor is weather, especially for us who are living in the Nairobi and its metropolitan. There is a lot of air pollution. So you find due to that air pollution, the dirt, the gases, and the fumes, they tend to come and stop by our faces, whereby they cause clogging. So that one also can affect someone to have acne. Also, you'll find someone who has changed weather conditions, like, for example, someone who is living in the coastal region where the weather is very warm. They tend to sweat a lot. The pores tend to be open a lot, and then you move to a place like Ruaka whereby the weather is cold, and then you don't tend to sweat a lot. That air weather can affect. Stress also can cause acne because stress usually activates cortisol hormone. So because we have said that also there is a type called hormonal acne, that one also can cause acne. Exposure to UV rays, the sun also can make someone start developing acne, and also hormones. Of course, we have already said that some start developing during at puberty, but also some start developing during pregnancy acne. So due to changes of the hormones, so also that one can make someone to develop acne. Some medication, someone will come and tell me, doctor, since I started using family planning, I have started developing acne because of the introduction of the hormones. Through that family planning, it can predispose you to start developing acne, and also chemicals. Chemicals, I know, especially for us ladies and gentlemen, we are trying to avoid anti-aging. We want our face to look brighter and younger. So we tend to have experiments with most of their products, especially nowadays with social media. That every brand is trying to advertise their own brands, saying that, oh, it's good for anti-aging, it's good for brightening, it's good for all kinds of sort of skin. So because of that marketing, they'll make you to want to explore and to use a cream, but you find that that product reacts on your skin, and then you end up developing a reaction by developing acne. So it's good to avoid medications. Touching on food, also food you don't have to, you I know there are people who work in the kitchen areas, and then they cook with greasy oils. Like for example, people who make fries and samosas, because of that moisture of oil, they will come and they block your pores, and then you develop acne. So that you can also develop acne due to the nature of your work. Yes, it's very good for me to know that. So due to the inflammation that develops due to acne, you can end up uh, getting hyperpigmentation due to the inflammation that usually develops after acne, whereby you get the black spots, or you will find out that some areas of the face they are darker than the other ones, and also you can get scarring. We normally, because of its nature, the acne tend to be very itchy, or sometimes the acne they become so cystic that you just want to pop them. Popping and pricking is very much discouraged because of the scarring. Scarring, which is of course a complication of acne. So kindly, you should think about visiting a healthcare provider so that you can come, we start a journey of treating it. Putting him, you don't have to come to the dermatologist because you have big pimples, cystic ones or nodular ones. You can come even when they are rash like, so that we can get you that flawless skin. And mind you, also acne doesn't only appear on the face. We have said that pores, they are all over the body, and we have oil glands in all over the body, but there are parts of the body that have more oil glands more than the other parts of the body. For example, the face and the chest and the back and the shoulders. That's why most of the people they tend to get acne on the face and the chest and the back. So depending on how you're presenting, we are able to tell the cause, we're able to tell the type and the approach on treating it. Okay, so it's very good for you to come. When you come for consultation, the questions that I can ask you is, for how long you have had it, how did it start, is there a family history of acne, because also acne can be genetic, whereby you find either your parents or your grandma, they have ever had this chronic acne, so there are high chances that you also are experiencing it because of the genetic factor. Any family planning that you're using, we can ask you to ascertain if it is the family planning that is bringing the acne. Also, we can also ask you about the products you're using, so that also to ascertain if they are good for the oily skin. Remember the last time we did a TikTok live, we talked about the different types of skin types. We have the oily skin, we have the dry, and we have a combination whereby you can have an oily but also at the same time a dry one. So products that you use, they need to be specific depending on the type of skin that you have. Okay, because it's not good for you to use a product for dry skin in your oily skin, and you're not supposed to use a product for oily skin in a dry skin. They usually vary depending on their ingredients, so it's very important. So when you come for consultation, and then we know the type, we discuss the causes and the types. Now we discuss on the treatment approach that we can take, whereby there are times that I'll give you an alternative for you to choose, but there are times that you have to agree with me the type that we'll have to do depending on the type. So on treatment of acne, we usually do topical and oral treatment. On the topical treatment, we usually we must have a good cleanser. We must, and also it's good for me to also know that treatment is different with skincare routine. When you have active acne, we have to put you on medicated products. Then after the duration of treatment that we take, after you complete the treatment, now I put you on skincare routine, something that is readily available and it's easy for you to follow up for the rest of your life. So the first thing is to make sure that you don't have active breakouts, you don't have pimples, you don't have acne vulgaris. So it's good first we stop the inflammation, we stop the blockages, we stop the dead skin through medication. So in medication, most of the time, it's a must for you to do topical medication, but most of the time, usually also involve oral treatment. In topical medication, I usually combine a cleanser, or rather what we normally call as a soap, a moisturizer, and sunscreen. And with the moisturizer, you actually like combining a morning cream and an evening cream, whereby we can have active ingredients of which are normally good and safe to use in oily skin. Ingredients like azelaic acid, salicylic acid, benzoyl peroxide, and tretinoin, etc. There are so many and very wide, depending on the type and the factor, the weather, if you're pregnant or not. So if it's hormonal, so we agree on what we shall start on, what we shall put you on for the duration of the treatment. Then we do oral medications. On oral medication, now remember we say that we have different types depending on hormonal. So we will agree if it is hormonal, whether to put you on hormonal therapy through contraceptives. If it is fungal, we put you on fungal treatment. Bacterial, we put you on antibiotics. And also, I personally like engaging products like tretinoin. Tretinoin helps, but of course not recommended for all types or for all people and not for all age groups. It's usually good for the treatment. So that's what we will talk. We shall decide. We shall agree on. Complications of acne, number one is low self-esteem, the most common one. low self-esteem, which affects your mental well-being. So it's usually good for us to discuss that, because you'll find some people, they are not even confident about themselves. But luckily for our clients, we have a psychosocial support at our facility, which we offer our clients in case we have such a condition, and also post-inflammatory hyperpigmentation. This is whereby the acne after healing, it leaves some scarring, dark scarring. And also we have those scarring which leaves scars, whereby scars usually develop when you find that your acne, it affected, we have uh, we have the epidermis, but now you find your skin, your acne affected the epidermis and the dermis, whereby they leave scars, which scars can be, mostly they are in form of, you can see someone with holes from on the face. That one is usually also a side effect, a complication of acne. So how do we, it's good for us to discuss how to avoid getting acne for those who have oily skin. Number one, you should at least teach yourself to be washing your face with a cleanser. Of course, a cleanser that is good for oily skin, with warm water. Don't use extremely hot water. Warm water or cold water is okay. Avoid using toners and exfoliants that irritate the skin. It's very bad. They can it can bring acne and also other complications of the skin, like hyperpigmentation. You should use products that are non-comedogenic to make sure that you don't get the blackheads and the whiteheads. And also for me to also not, in case you get the hyperpigmentation, there are usually some procedures that one can do, some therapies that you can do, something like laser treatments. Nowadays we have microneedling and also chemical peels that help to reduce to treat the acne, and also the same to reduce the scarring. So you don't need to worry about that. So anyone who is struggling with acne, or a friend, a colleague, a neighbor who has that issue of acne, you can refer them to any of our 3 branches to come for dermatological consultation. We accept insurances and cash. For cash, consultation is 2,500. So you're all welcome. Now I feel it's ready for me to open the forum for any questions. Anyone with any questions, kindly feel free to ask. Okay, thank you for all those who have expressed their concerns. Number one, there is a client asking if acne is genetic. Yes, so when I was saying about the types of acne, I also had said that acne can be genetic. Yes, so the answer is yes. At what age does acne usually go away? Acne, if you don't take care of acne, you can even get into menopause. And also it depends with the type that you have. Is it hormonal? Is it fungal? Is it bacterial? So it's indefinite for me to say at this age you don't experience acne. So for that one, usually depends. So don't wait for the age to get so that your acne can get away. You can visit us for consultation so that you can start this journey of acne treatment. Can acne be completely cured? Yes. Acne can be completely cured? Let me answer this. There is another client that we had who had concerns, because when you have acne treatment, of course you're expecting them to completely disappear. But for us ladies, most of the acne, they are also partly caused by the hormones. So because of the menstruation and the hormones that are usually involved, you will get that during your periods you may have few of like a number of 1 or 2 acne. So you should not feel bad because you have 1 or 2 acne, because and as long as it disappears after menses, you should have a worry if it persists for long. So yes, acne can be completely cured, and that's why you need to use non-comedogenic products to make sure that your oily face is maintained without any breakouts. As a grown up, why am I still struggling with acne? We say that acne may start as early as from 11, because we can come for consultation. We treat it so that you can get that permanent solution. Okay, so kindly come. We talk about the products, and if you're not comfortable about taking the tablets, we can discuss on the topical medications that you can be using to make sure that you stop struggling with it. Yes. Can lack of sleep cause acne breakouts? Yes. The reason as to why I'm confidently saying yes is because when you lack sleep, most of the factors is because you're stressed, right? Or there is anxiety issues. And when you're stressed and when you're anxious, you tend to activate a hormone called cortisol. And what does cortisol do? It usually affects the system of sebum production. So you find that you are producing more sebum. Sebum is oil for the skin. You're producing more sebum than the way your system should do. So you end up causing clogging of pores, and then you develop inflammation due to also accumulation of bacteria, and then you end up with acne. So kindly try to sort that issue of sleep. Make sure you get at least a minimum of 8 hours of sleep. If it is stress, you sort it, and if you're not able to sort it, I don't know how to help you, but kindly sort it out. And also, if you're lacking sleep, you can try to involve something that will help you to sleep. For example, you can maybe play some music, put some rings, and then it will make you sleep. So kindly try to sleep. Another client is asking, how often should I wash my face if I have acne? How often? How often? Twice a day. I'll say twice a day. Morning. I say it depends. It depends with the nature of your work and where the weather, even the weather, because sometimes you can be working and then you sweat profusely. You may need to wash your face at least thrice or even 4 times, but the standard, the minimum should be two times. The minimum amount, at least twice. You wash in the morning and you wash in the evening before going to sleep. So it should be twice, a minimum of twice. Often, the number increases depending on the how your day is usually like. Which natural remedies can I use to get a smooth skin? Which natural remedies can I use to get a smooth skin? Number one, natural remedies, I will start by encouraging you to eat a balanced diet. Avoid junk foods, avoid pizzas and chicken, because those processed food, they tend to affect the sebum production system. Avoid sugar, eating excessive sugar and carbonated drinks. Avoid eating a lot of wheat. If you're taking 4 slices of bread, maybe you can start taking 2, because those factors usually make you to get acne. Another natural remedy, maybe you should start a culture of washing your face before you sleep and early in the morning when you wake up. I know most of the people, personally, even my own people around me, at night they normally don't wash their face when they're going to sleep. So it's important when you're going to sleep, you wash off that bacteria, that air pollution that you went through your day. So go to wash it before you lie down. You should change your pillow your pillowcase often to avoid the bacteria getting into your skin. You see, even now we spray our hair. Some people, they don't cover their hair. You sleep on the same pillow that your hair touches, and then that oil gets into your skin. So it's good to regularly change your pillows, and then you make sure you have a good cleanser for the morning and a good moisturizer. I don't feel comfortable for me to tell you exactly the brand to use because we have so many varieties and depends with your accessibility and affordability. So this, when it comes to products, I think it's best when you visit for physical consultation. Another client is asking us, is it true birth control pills can help with acne? The answer is yes, but only if you have hormonal acne. Okay, so it's good for the dermatologist, and that's why it's very good for you to visit a dermatologist because there are those questions that we usually ask. We're able to see the moment I see your face, I'm able to tell this type of acne, and that's why also at the same time, I usually get some clients insisting they want to do skin analysis to check about the acne. But you know, skin analysis will only tell you about your moisture, your blocked pores, your sun protection factor, and they won't tell you the type. The type is for the dermatologist with the experience to be able to know the type that you have, and also depending if you have other conditions, because I also understand that there are some clients who have some hormonal conditions like the ovarian cyst, whereby you get someone having the acne. So if you have hormonal acne, then we do treat using contraceptives, those birth control pills. Which are the best treatments for acne that I can get in the chemist? That question I've already answered. Can acne scars be treated or removed without laser? What can I use? Can acne scars be treated or removed without laser? It yes, yes, it's possible without laser. We have products in the market, especially products that have azelaic acid. Azelaic acid, they try to help with acne scars, but it depends with the scars that you have. If they are past the epidermis to the dermis, then you will need a procedure, either the laser. If you're not comfortable with laser, you can opt for microneedling. You can opt for PRP, platelet-rich plasma, and you can also opt for get faster results. But now with the products, you'll have to be patient. So yeah, you can check those options and then you see which one is good for you. There is I don't want to mention brands. I've said I won't mention brands because of the issue with accessibility and also affordability. Now, the other question that another client has asked us is, tell us the best skincare routine we should use to avoid acne. Tell us the best skincare routine we should use to avoid acne. This is a good question. Say kabla ya tiba ni kinga, si ndio? So first you must use something to make sure that you prevent yourself from getting acne. If you know you have an oily skin, number one, it's good for you to use a cleanser and a moisturizing sunscreen. So the best thing is to make sure you also wash your face twice in a day, morning and evening, okay? And then you make sure that you have a good cleanser that is good for oily skin. We have products that are good for oily skin, and that's why I mentioned about it's good for you to use a cleanser that has salicylic acid or azelaic acid. Usually helps with avoiding the inflammation and also helping with the dead skin, dissolve the dead skin to make sure that you're producing new skin cells. So kindly make sure you involve a cleanser, sabuni, a moisturizer, mafuta, and sunscreen to make sure that you don't develop acne. Another thing that is good for me to mention is that sometimes you will find that you are having acne on specific parts of the face. Also, and that's why I mentioned that part whereby also acne can be caused by chemicals. When you spray your hair, when you use hair oil, they are not good for the skin. So when you bring your hair on the front part of the face, and they tend to cause that blockage, they tend to cause that clogging on the pores. So it's good also to make sure that your hair doesn't come on the front part of the face. Number two, for those who are using makeup, it's good to use to make sure that you don't sleep with your makeup because to avoid the clogging. So you use product. You use products that help to remove the makeup fully. Most of the time, a client will tell me, Daktari, I've washed my face, but when it's time to even use the white wipe, or when you're performing a procedure like hydra facial, you'll find that they are having that color, that layer of makeup. So make sure you use a good product like the, I believe most of the time we clients, those who use makeup, they tend to use rose water to remove the makeup. And then also makeup, they depend whether I've seen some makeup, they're very heavy. So can they use something that is able to remove the oil part of the makeup? Most of the people with oily face, they tend to use kipandis because they believe if I use kipandis, it's mild. It will make me not to get acne. It's wrong. It's wrong because of course the bar soaps, they're usually made purposely for washing, and the skin is usually slightly acidic. And for the bar soaps, they are more acidic, so they can irritate your skin and even make you to get more breakouts. And even if you're using the bar soap and you're not having the breakouts, and you kind of feel that it is helping you, you should also consider about the damage that it is bringing you. That's why most of the people you'll find that they look older than their age because of using bad products. They have started developing crofates and wrinkle lines because of using the wrong products. So kindly make sure that you align your skin with the right products. Okay. Another question. Can someone develop acne at 25 years? Yes, you can. You have said acne. It can also start on your adulthood, depending on the factors that we discussed about what can cause acne. What can I apply on my neck and armpits because they are too dark? Can implant cause acne? What can I apply on my neck and armpits because they are too dark? Neck. Why will your neck be darker than your face? But that's answer. It depends whether the products that you're applying on the face usually apply on the neck. And if you have also noticed that, it's good for you to come and visit, because maybe your skin also can start thickening on the neck and you're not aware, and maybe you can get your product that will help to smoothen it, to make sure that it is not thick. And also, I would like to ask the client who has asked this question if they're using sunscreen. Have you involved sunscreen in your day-to-day use? It's very important for us to talk about that. Armpits, they are too dark. Armpits, they are too dark. Armpits, they are not supposed to be white because the armpits tend to sweat a lot. There is usually a lot of moisture compared to other parts of the body. So the armpits, even your genital area, it's not supposed to be the same as the part of the skin. Kindly let's all of us agree on that. The armpits and the genital areas are not supposed to be the same as the part of the body because of the glands that are usually available there because of the sweating, because also of their location. But also on the armpits, I would also like to ask if you're using roll-ons. So there's some roll-ons that tend to make someone to appear so dark. So it's good to also check on that. And at the same time, you can involve some serums, some creams, especially creams with niacinamide. They tend to brighten your armpits naturally. So you can try to get the niacinamide serum for the armpits. Can implant cause acne? Yes, we said family planning, which is a type of medication, can also cause acne because of the involvement with hormones. So yes, it's possible. Implants can also cause acne. So if we don't have more questions, I would like to thank you all for joining this live. There is someone who has decided to ask the last minute. Let's wait for them. But also at the same time, let me thank you all for your time to join this live session. We at Jacaranda, we have so far 3 branches that are doing dermatology clinics. On Tuesdays, we're doing clinics at Kahawa West from 4 p.m. to 6 p.m. On Wednesdays, we're doing clinics at Ruaka from 9 to 11 a.m. And on Fridays, we're doing clinics at Umoja branch from 9 to 11 a.m. We accept all types of insurances and cash. We allow appointments. Appointments, they are very much encouraged for you to they're very much encouraged for you to book an appointment. Why do we change identity when pregnant? The color pigmentation, especially face and neck, because of hormones, darling. When you become pregnant, you tend to start, you tend to, there are hormones that usually start being active in your body that are not there. And because of those hormones and the photosensitivity, the sunscreen, the sun, and other factors in forward. That's why most of the people, they tend to get darker because of the hormones. But the beauty about it is that after pregnancy, the darkness usually goes out. It's not a permanent solution. It's only a temporary thing during pregnancy. So you should not worry about it, not unless it is affecting your mental wellness and your self-esteem. Okay, so it's because of the hormones. Someone is asking also, since she has mentioned about pregnancy, there is one thing I had planned to comment on. I almost forgot. It's very important for me to say. Nowadays, most of the people, they're using this product called tretinoin. Tretinoin is available in form of cream, gels, and also tablets. I would like to warn all ladies who are planning to get pregnant and also who are pregnant. When you use tretinoin, whether in form of creams, serums, or tablets, they tend to affect your fertility in form of when you get pregnant, your baby can have malformations. So if you're planning to get pregnant and you're using tretinoin for acne, or you're using tretinoin for anti-aging, kindly stop for a while. You get pregnant, you get back, you bath, and then you can resume to continue using it. Okay. Then there is another client who is saying, is it advisable to use azelaic soap while pregnant? Yes, it's advisable. It's okay. Azelaic soap is good for for controlling the inflammation that usually develops with acne. So yes, you may continue with azelaic soap. Having that in mind, thank you so much for joining. My name is Kagendo Mujuri. Till next time. Bye bye.